Good evening. This is Connect with Jacob Brier. I'm Jacob Brier, Barrington Town Council, and I'm hosting this live stream, as I've been doing over the past week or so, to create an opportunity for connection between myself and the community so that we can do our part to narrow the distance that we're all feeling as we practice social distance to flatten the curve and reduce the impact that the coronavirus has on hopefully not overwhelming our healthcare system. This evening I'll be speaking a bit about the business community and the support that's available for the business community, and about PPE, personal protective equipment, both for medical workers and then also for the general community. And first I'd like to start by sharing some of the statistics that have come out today from the Rhode Island Department of Health regarding the impact that coronavirus is having. There are just over 650 positive cases in Rhode Island and 72 hospitalizations. Unfortunately, 12 people have passed away to coronavirus or COVID-19. And in Barrington, we have 13 positive cases currently. I'm not aware if any of those folks are among the hospitalized or not, but we wish them and all people suffering from this the best health, and we wish our healthcare workers strength and success in their efforts. About the business community, the first thing I would like to discuss is the conference call that Lieutenant Governor Dan McKee hosts twice a week, every Tuesday and Friday at noon. The Lieutenant Governor hosts a conference call that is an open opportunity for members of the small business community or anybody interested in learning about what's happening with the small business community to call in. The dial-in information is on my website, jacobbrier.com/connect, and then on that page there's a link to the resource page where it has all the details for the call-in. Tomorrow's call, he'll be having Senator Jack Reed on talking about the CARES Act, which is the stimulus package that Congress passed and the President signed into law. And he'll be talking specifically about the Paycheck Protection Program, which is an opportunity for businesses to take out loans through the Small Business Administration. They can go directly there or work with their preferred bank, and they can receive a loan, a very low interest loan, equal to 2.5 times their monthly payroll, and they can use that to cover payroll, to cover rent or mortgage interest, and to cover a certain number of other permitted expenses. And a portion of that loan can be forgiven, and the portion that is not forgiven has a very low interest rate. If that's something that your business would benefit from, if you're struggling now, certainly call in, learn about that program, reach out to somebody at the Small Business Administration and ask. Also available for the business community, the state government, the Commerce Corporation, or Rhode Island Commerce, is offering a wide variety of support. There are two things specifically that I think are of particular note and particular interest, and that is bridge loans. So this, the Paycheck Protection Program and other Small Business Administration loans can take a while before all the paperwork happens and everything gets through the process and the check is finally received. Businesses that are struggling now that need funds immediately so that they can keep getting food to us, keep the manufacturing line running, keep whatever it is they're doing, if businesses are operating now or if they've had to cease operation, whatever the case may be, you have costs that you need to cover. These bridge loans offered by the state are able to help bridge the gap between when you fill out that application for the small business loan and when you actually receive the funds. To learn about that and to learn about the other program, which I'll talk about, you call 521-HELP. That's also available on my site, and you can see it right on the screen now as well. The other program that they're offering is technology support. If your business is not online yet, not able to accept online, retailers were forced to close their indoor operations, but they can still sell their goods and wares, potentially services, online if they're able to, or by phone. But if you're not online yet, call 521-HELP, and folks there will be able to help you get set up online so that you can showcase your products, your menu of items, and also be able to take payment over the internet as well. So I encourage you to call there. Locally, we have the COVID hotline. If you call Town Hall, the number is 247-1900, and then the COVID hotline is extension 384. That's an opportunity to find out what resources are available locally to help either businesses or individuals, and is also an opportunity where if you're able to provide support in any number of ways, if you can call that line and find out if there's a way that you can help, you can say what you're willing to do or ask what needs to be done, and you can find that as well. So those are some of the things I'd like to share about small businesses. Hopefully some of it's helpful to you, and please head to my site and you'll be able to find links and additional information about those resources. I received just before this broadcast some information from a group which I'm a part of, the Barrington Community Action Team. We're a group of people who are volunteering some extra time around now to find different ways to help the community. The idea for this came about through that group, and I'm going to share two other initiatives that are going on now. The first is an initiative, and I apologize for reading, but this is just in, so I haven't fully familiarized myself with all the details, and I want to make sure that I get the information right for everybody. So this is an initiative that has been launched through the Barrington Community Action Team. We're going to be producing signs that have uplifting community informational messages, and we're looking for any stores that might want to hang those. We also have lawn signs that are being produced, and those can be reserved. Now, these did cost money to have brought in. They cost about $6 each. If you would like to have one of the signs, you can have one at no cost. If you're able to chip in $5 or $10 to help offset the cost, that would be terrific, but it's not necessary. Please contact me at jacobbrier.com/connect. There are plenty of ways to contact me on my website, or you can reach out right on Facebook. Two of the lawn signs that have already been ordered will say on one side, "Just stay home and we'll be okay," and the other side says, "Social distance is working," because it really is. We have slowed the spread. We've started to flatten the curve. If you look at the chart, it is quite steep, but there is certainly reason to be hopeful and reason to believe that what we're doing, the policies put in place and the way people, for the most part, have responded have been good. We hear Governor Raimondo telling us to knock it off a lot. But that's because it's really critical that everybody do as much as possible. She knows, we know, we all know that a lot of people are doing a tremendous amount to do all we can to protect the community, and that's evident, but we certainly can keep doing more. And these signs hopefully help encourage that. Additionally, with those lawn signs, a local art director and professional artist are working together, donating their time and energy to create handmade street art. That can be arranged, it can be personalized. If you reach out to me, I'll be able to connect you and we can have that. Those can be signs that are hung indoors so that they're protected. They're looking for additional donations of either Rust-Oleum 2X or Krylon Fusion paint in dark blues, golds, or yellows. They have some donations coming in, but they could certainly use more. They need large format posters, old banners, really anything that they can use the back of. They'll be hung indoors, as I said. They can also accept tax deductible donations. So it can be an in-kind contribution that you can receive a tax benefit for. They have, the Barrington Community Action Team has a nonprofit fiscal sponsor, so contributions made are tax deductible if you make a financial contribution as well. The other message that I have connects to the second topic that I'd like to discuss, and that's personal protective equipment. So I'm going to read this message and then I'll talk a bit. Oh, I can take this off the screen here. Let's see. There we go. We can come back to this. The next message, actually, I will put this message up. This message here is from the Rhode Island Mask Makers Network. Rhode Island Mask Makers is a local initiative that came out of the Barrington Community Action Team here in town. It's very focused on the masks issue for some time. They've been in contact with the town council and with the town manager, advocating for the adoption of new guidelines that individuals cover their nose and mouth with anything like a bandana, a simple cloth, anything really when in public. For healthcare workers, they're making masks via a network of home-based volunteers. This design was created to be easy to make because it's both easy to sew and all the materials are found around the house. If you look up Rhode Island Mask Makers Network on Facebook, you'll see a template. The mask has a pocket for removable filters. If you can sew a curtain or hem using a sewing machine, you can follow the simple instructions on their template. They're constantly expanding and are looking for donations or loans of working sewing machines, 100% cotton, tightly woven fabric. Quilter's cloth is ideal. Xeroxing services, 1-gallon Ziploc bags. And recently they've also been connecting with other volunteer makers who have lost their jobs in other industries and know how to sew and can produce the same masks via a donation to a nonprofit that will be used to employ these individuals. They are arranging for the general public to be able to purchase these masks. All of this information will be posted on my resources page and is already available on Facebook if you go to the Rhode Island Mask Makers Network. And so that brings us to another topic. As we have heard for months, there is a concern of a shortage of masks, of specifically N95 masks. Surgical masks are in shorter supply, and other protective equipment for first responders, for healthcare workers like doctors, nurses, certified nurse assistants, nurse anesthetists. Everybody working in the medical field is very much in need of this protective equipment because it's truly life-saving for them and for the patients they're treating. There are hundreds of patients in the hospital who do not have COVID-19, who are there for any number of other reasons. It's important that we do all we can to protect patients in the hospital, workers in the hospital. And so there are two ways to protect them. One is to ensure that they have the equipment possible. I saw an article today, the New England Patriots actually flew out their jet to China, picked up over 1 million masks and flew it back here for our healthcare workers. It's terrific, and it's great to see the community coming together to support our workers like that. The other thing we can do to protect them is to do all that we can to limit the spread of coronavirus. And one thing we can do to help with that is to wear our own personal protective equipment out in the community. Now, there's divided opinions about what to do and how to do it, but if you wear a covering over your mouth and nose, you are less likely to spread the virus. That if you have it. We know that approximately 25% of people who have been infected with coronavirus are still symptom-free, whether they may never develop symptoms or they are contagious prior to developing symptoms. So if we all do what we can, the most important thing is to stay home, to stay home and to wash your hands. If you are going to be in the community, if you can also keep your germs to yourself, we do that by physical distance between people, and we can also do it by covering our face. And there are many ways to do that. It is important that we not diminish the supply of surgical masks and N95 masks that are really needed for the healthcare workers and the frontline workers and first responders who are interacting with far more people, and most of the people are infected. And so they truly need that. But if we can also do all we can to limit the chance that we spread our germs and also that we become infected ourselves, it's really critical. We're in a period of time now where we all really need to come together and do the best we can to protect ourselves and to protect those who are working, who are risking their lives and spending their time and energy to protect us and to take care of us and our family and our loved ones and our friends and our community. We owe it to ourselves and to them to do all we can. And I would like to close by sharing what we'll be doing next time. The next airing will be Sunday evening. My son has asked to join. He is 8. We will be talking about different games and activities that can be done with kids to entertain them. Specifically, I believe we'll be doing some Lego demonstrations. And in addition to that, we'll also talk about how he's getting used to distance learning and how myself and my wife are getting used to his distance learning and our working from home and taking care of things as he distance learns with us. So that'll be Sunday night at 8 o'clock. We're going to do it a little earlier because somebody has a bedtime that conflicts with the normal airing. So I'd just like to leave you with a quote, and it's a pretty well-known one. All for one and one for all, united we stand, divided we fall. That is Alexander Dumas. And one amendment I would like to make is right now, united we're staying home. Divided is how we'll succeed. But the principle and the message still remain. This has been Connect with Jacob Brier. Thank you very much for tuning in. I'll see you next time.